All right, as you will have all heard, I did just turn the recording on. So I think we should probably get started. So welcome everyone. And thank you very much for joining the Research and Dialogue Speaker Series. We're thrilled that you're able to join us today for the third and final episode of the season. As some of you may know, my name is Amanda Everall. I'm the Knowledge Translation Coordinator for the research group here at the BC Centre on Substance Use. I'd like to start out by acknowledging that myself and the presenters today are joining you with gratitude from the unceded traditional and ancestral territories of the Coast Salish peoples, including the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. The reach of the work that we do here at the BC Centre on Substance Use touches the territories of all 198 First Nations in BC. I'd also like to take this time to recognize that the ongoing criminalization, institutionalization, and discrimination against people who use substances does disproportionately harm Indigenous peoples. I'm going to very quickly go over the format for today's talk, after which I'll pass the mic over to Matthew Fleury, our new Director of Indigenous Initiatives, who'll be providing an introduction for today's speakers. As you might have noticed, and as I mentioned earlier, we are recording the series today. So we'll be posting the video online on the BCCSU website as well as on YouTube. As such, you're more than welcome to keep your cameras off if that would be your preference. You'll also notice that I have muted all attendees for this webinar. So we're going to be starting with a presentation of research findings, followed by a response placing this research into a real-world context. After the presentation, we'll have time for a question and answer period, during which you can either type out your questions using the chat box function, or you can use the raise hand function, which is in the reactions tab at the bottom of your screen, and I'll be able to unmute you at that time. I'll also quickly mention that today's webinar is going to continue until 1:30 p.m. This is to provide additional time for question and answer should we need it. Of course, if you need to step out before then, please do feel free to do so. And with that, I will pass it over to Matthew to get the talk started.
Thanks so much, Amanda. I appreciate that introduction, and I'm really excited to be welcoming you all today to our speaker series. My name is Matthew Fleury, and I'm the Director of Indigenous Initiatives here at the BC Centre on Substance Use. I'm joining you today, like many here, from the traditional unceded ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. I just wanted to begin by providing a couple of backgrounds or bios about our two speakers that we're really pleased to be having here today. So I'll start with Dr. Lindsey Richardson, is an associate professor of sociology at the University of British Columbia, research scientist at the BC Centre on Substance Use, and holds the Canada Research Chair in Social Inclusion and Health Equity. As a medical sociologist, she uses quantitative, qualitative, and experimental methods to examine the dynamics and health consequences of socioeconomic disadvantage among people who use illicit drugs, with a focus on public policy reform, community economic development, and critical approaches to research participation. Her overarching goal is to leverage research to address socioeconomic drivers of drug-related harms and health inequity. As well, we'll be joined by Tara Taylor, who has been working at the grassroots level in the nonprofit sector for 18 plus years. They've been an active champion of sustainability, working and thinking across multiple disciplines and the sectors to develop community systems that promote social justice alongside a balance of community well-being and community development. Tara currently works for the Spencer Creo Foundation as the executive director and is chair of the Overdose Prevention Society. Most of their work is in Vancouver's downtown east side, focused on supportive employment, social enterprises, and harm reduction best practices. Thank you very much for joining us today. And maybe with that, I will hand it over to both of you.
Thank you so much, Matthew, for getting us started in a good way. I'm going to share my screen in a moment, but just want to say at the outset that it's a true pleasure to be with everyone here today and to be in dialogue with Tara. A real privilege and an honor to share the space with you and to see what we might cook up. And so I'm going to start with a sort of high-level overview of some research that I've been working on with my team and others at the BC Center on Substance Use for quite some time now. And I'd like to start here. And many of you will recognize this photo from a memorial that took place in Oppenheimer Park in September 2017. And each one of those stakes represents a life lost to the toxic drug supply. And at the time, we thought that, we were dealing with unprecedented levels of loss and of grief. And in retrospect, we now know, of course, that things were just getting started, unfortunately, and that we find ourselves in an unprecedented landscape of toxic drugs and death. And I say this at the outset just to recognize I'm going to be presenting research, and that research comes from the narratives and the lives of real people and people who are dealing with levels of grief that are kind of unfathomable. And so I want to offer that at the outset. I also want to start with my acknowledgements, because the work that I'm going to present today is a collective effort that is the result of collaborations and cooperations with a range of organizations, individuals, institutions, an exceptional co-investigator, student researcher, and staff team. And so I present this work in knowing that and wishing to convey that it is really a collaborative effort. And so I want to start here. This is the most recent dashboard from the BC Coroner's website that tells us that we are on pace this year to have another sort of catastrophic year in terms of the levels of mortality that we are seeing from the toxic drug supply. And in that context, also really want to acknowledge the exceptional work that's been done by a range of people, many of whom are in the room today, to try and do whatever is possible to address that harm, to address the overdose crisis and drug-related harm related to the toxic drug supply. And some of these interventions, like naloxone distribution and training, or supervised consumption, or innovative clinical practice, have all sort of become standards. And I put that in quotation marks, excuse me, in part, because last year I had the opportunity to do some research abroad, and it was very striking to me how things that we now take as just given in our context in British Columbia and in Vancouver in particular are things that people are fighting just to initiate. And so really want to recognize those battles and the work that is being done across BC, across Canada, and across North America. I also really want to recognize that we have a culture of innovation here. And yes, innovation is often hard-fought and difficult, but whether it is innovative clinical prescribing practices, whether it is community-initiated safe supply initiatives, what we have here is something that is really unique and innovative. And I think we all stand shoulder to shoulder in really having the same objective. What all of the interventions that I've depicted here have in common is that they are all really focused on the administration of a drug to a body, right? Something that someone takes and ingests or inhales or injects. And what we know from decades of social science and public health research is that context is also really important. And often when we are focused on these innovations, a lot of the characteristics of the broader context get left out. And so what I would like to convince you of today is that we should be paying attention to that broader context, and specifically the socioeconomic dimensions of that broader context. And so when we're thinking about this in the context of the drug poisoning crisis, there is some relatively recent research that's come out. The top study came out in 2020, the bottom one just in March of this year, that really assesses the state of research around socioeconomic well-being and overdose. And what I just want to talk about very briefly is that, particularly in the quantitative world, there is a real paucity of work that meaningfully engages with questions of socioeconomic well-being. While the research that does exist tends to find predictable associations where higher levels of disadvantage are associated with worse outcomes, there really is not a lot of work in this area. And the qualitative work that we also synthesized in the bottom narrative synthesis really is informative to try and think through how we can be doing more of that research and trying to make it impactful. And the reason for that is because the qualitative work that's done through narrative interviews and sort of deep textual analysis identifies a lot of the mechanisms and pathways that connect socioeconomic disadvantage with drug poisoning and overdose risk. And I recognize the text here might be a little bit small, but what I would like people to take away from this is that it's not just about money. It's about how money shapes behavior, how money or the lack of money affects our psychological well-being, how it affects our social relationships, how it affects our broader environment. And all of those things have something to say when it comes to drug poisoning and overdose risk, and that there is an institutional overlay in all of this where our institutional policies and practices affect all of these mechanisms and pathways and often reinforce socioeconomic disadvantage. And so, I'm not going to focus the entire presentation on overdose. I'd like to broaden our conversation a little bit, but I say that as a backdrop just to emphasize how important it is to think broadly about people's context when we're thinking about the health and well-being of people who use drugs. And when we're talking about socioeconomic disadvantage, we're not just talking about money. We're talking about material securities, economic participation. We're talking about the broader policy environment that inhibits or supports people's economic activities in particular ways, and health and criminal justice policy as well. And so the plan for today is that I'm going to walk you through a very specific train of logic about how I've come to think about the economic lives of people who use drugs. And I'm going to focus predominantly on my team's research, but I'm going to cover a lot of territory. So know that there's more to be said here. Most of the research that I'm going to talk about has taken place in Vancouver, and it uses data from studies that are hosted by the BC Centre on Substance Use. So the Vancouver Drug Users Study, the Access cohort, the Arise cohort of street-involved youth, the Check Day experiment that was operating between 2015 and 2019, and the newer Assessing Economic Transitions cohort that really focuses on economic engagement. I am not going to get into the mechanics of that research. I don't think that's the best use of our time together. I am going to focus on high-level substantive findings and takeaways that I hope really contextualize this for you. And so the first piece of that logic is that employment has important impacts on well-being. And we know this to be true in the general population through decades and decades of research. And there's been less work on it among people who use drugs, but it's something that, as I will hopefully demonstrate, is still exceptionally relevant. And we can think about this in a bunch of different ways. So we can think about whether or not employment is related to drug use and drug use patterns. And what we have seen in the research that we've done is that employment in general is associated with lower intensity drug use and things like being less likely to transition to injection drug use. So for example, this graph demonstrates how employment is one of the things that distinguishes between whether or not people move from non-injection to injection drug use. This study particularly focused on youth. We can also think about it in terms of whether or not there are links between work and other health outcomes and treatment. And here what we know is that people who are employed tend to have improved engagement in both HIV care and substance use disorder treatment. They tend to have higher socioeconomic stability, and they tend to also have lower levels of mortality. And this raises the question of, okay, are we thinking about employment at a given point in time, or are we thinking about the broader trajectory of work in people's lives? because often it is that employment trajectory that we should be paying attention to, the longer term considerations around economic engagement. And very briefly, this is a study that tried to take that into account, where we looked at people's long-term economic engagement and different levels of economic engagement in the longer term, and tried to differentiate between tried to look at whether or not that predicted particular things and whether or not they were more and less likely to happen. And essentially what happened in those analyses is that when we distinguish between whether someone was employed never or a little bit or sometimes or a lot, the higher their level of labor market attachment over time, the better their health outcomes, the better their substance use outcomes. And so we can think about this as not about being in a job at a particular moment, but a general ethos of labor market attachment, and knowing that it is often a stabilizing thing for folks. Okay. So this slide essentially summarizes it. In the interest of time, I'm not going to read it out, but it essentially just reiterates the things that I've just mentioned about drug use, engagement in care, stability, health outcomes, and what happens following employment exits and with longer labor market attachment over time. Second piece of logic is that most people's drug use does not negatively impact their work. Some people who use drugs have lower employment levels and higher job instability. So on the whole, most people manage their drug use and their employment simultaneously reasonably well. And for some people, that's less the case. And so what you're looking at here is 15 years of data from the Vancouver Drug User Study and the Access cohort. And that top blue line the blue line at the top is people's overall level of employment at a given point in time. And that's formal employment, self-employment, and temporary employment. That red line underneath is the employment entry rate. So people who are actually reporting employment at a moment in time when the last time we talked to them, they hadn't reported employment. And what this graph tells us is two things. First, that levels of employment for people in the study who are residents of, predominantly residents of Vancouver's downtown east side, have lower employment levels than the general population. And also that there's a lot of churn. And by churn, I mean people moving in and out of employment. And when we think about that in the context of labor market attachment, broadly speaking, we know that that's not necessarily a bad thing, but that there's work that can be done to support people's retention and employment. And I'll pick that up a little bit later on in the presentation. Alongside knowing that, in this cohort, levels of employment are a little bit lower, it's also important to think through, okay, what's actually going on for people? Is it because of their drug use? Is it because of something else? And we actually explored this in a qualitative study that came out a few years ago, where we looked at what was going on. What came first, the chicken or the egg? And what we found was that often it's people's employment that shapes their drug use. It shapes whether or not they use in the evenings and on weekends or regularly throughout the day, depends on the quality of their employment, etc. We did find in some instances that people's drug use precluded participation in employment, formally speaking, whether it was because of impairment or because the requirements of seeking out drugs in an illicit market really took up so much time that it made it difficult to be in employment. But what was most important about this study is that in both people's employment trajectories and their drug use trajectories, it was usually something else entirely that was affecting both. And so we often conflate, people's drug use means that they don't work, but often what's going on is something much bigger that interferes with their ability to work and with their substance use and affects their substance use patterns. And so it really, this study really challenges common beliefs about the relationship between drug use and work. The next piece of the logic that I want to walk you through is that whether or not people move into employment is linked to their social and physical and structural environment. And we've conducted a suite of studies here that really looks at barriers to employment, what affects whether or not people are able to move into work. And for example, we've looked at regulations around addiction treatment. And of course, we can all imagine that the daily supervised ingestion of methadose or methadone is really a difficult thing to then take and move into a new job. There's one study here that I'd like to highlight in particular, and it's this one that looked at social and structural and physical environmental features and whether they affected people's transitions into employment. And what we did for this study was we looked at employment transitions as our main outcome of interest, and we conducted a series of statistical models that successively added different categories of quote unquote risk. And the first category that we looked at was high intensity drug use across a range of different substances. And what we found in those first analyses is that they inhibited people's ability to move into work. When we added a second kind of risk, so drug related but not drug use, those factors, those variables had no relationship with people's ability to move into work. And what was most interesting for this study is when we looked at broader exposures in people's environments, like their housing environment, like whether they've been recently incarcerated, those things significantly and negatively impacted their ability to move into an employment position. And when we added that to our model, the drug use variables that we looked at previously became unimportant, with the exception of one, and that was frequent heroin injection. And so what this tells us is that we often conflate drug use with broader contextual risk. We often are looking and pointing at drugs when actually we should be looking at people's broader environments to figure out what could be changed about those environments to support economic engagement.
So Lindsey, can I ask you a question there?
Yes, please.
Cool. Just because I'm more familiar with your more recent work and not so much as some of the stuff you've been referencing, kind of some of the older work there. When we're talking about employment, is it a kind of across all the different articles and publications you're referencing? Some of the work that we're seeing at consumption sites, injection sites, are we talking about traditional employment? And maybe you define it a bit more in, but I just wasn't sure if all of it ties to the same kind of employment or if it changed after some time.
So what we look at here is whether it's a regular job, a temporary job, or self-employment as defined by the participant. And so if they see their peer work as a job, it gets categorized as such. And most people do. Most people think about it in that way.
Awesome. Thank you.
Great. Okay. Next piece of logic. Without adequate income, people who use drugs often rely on prohibited or illegal income sources that are linked to serious harm. So knowing that levels of economic engagement are a little bit lower than in the general population, and knowing that there are all these barriers to economic engagement, what do people do for money? They're often relegated to prohibited or illegal income sources. And so, for example, this is the income generation profile of the access cohort over a 10-year period. And what we see here, that top line, that gray dotted line, is the level of income assistance receipt. And we will come back to that later on. The black line is an aggregate of all other prohibited and illegal forms of income generation. And so we see that people are supplementing their income assistance with these prohibited and illegal forms of income generation. And this is unsurprising to anyone who's done work in the community or work with members of the community at all. What becomes important is thinking about the benefits or harms that those forms of income generation confer on the people that undertake them, right? And so what we know is that they provide a flexible, optional income source where people have individual agency. They can decide what they do, how they do it, when they do it, to a degree, right? There's some level of choice there. Often people are dealing with really constrained choices. And what we also know is that people undertaking these activities are exposed to higher levels of harm. So they are often engaged in higher intensity or higher risk drug use. They may be exposed to violence. They might have increased likelihood of having negative police contact and incarceration because many of the forms of income generation are criminalized or prohibited. And often engaging in these kinds of activities might interrupt their substance use disorder treatment, other social care, etc. So There is a particular study, in the interest of time, I'm maybe going to gloss over this a little bit, but this study that was led by a doctoral student of mine who's soon to be a professor in Massachusetts, Kate Jaffe, looked at whether or not people's income generation patterned their substance use. And what was really interesting about what we found was that findings for women and for men were really similar across different kinds of substance use. So this is a data visualization that summarizes a large number of analyses. But essentially the takeaway is that the income generation milieu, the spaces in which people generated income, was more strongly related to their drug use patterns than a lot of other characteristics, including their gender. And so you can imagine, for example, someone who's engaged in street-based income generation and needs to be alert and needs to be active might be more likely to engage in high-intensity stimulative use, for example. Okay. One of the things that's really important here is that often people who use drugs are blamed for not having a job. That's a very common sort of stigmatizing narrative that exists. And some of the research that we've done has demonstrated that's really not a function of their capacities or their willingness, right? And so what you're looking at here is a graph that shows on those bottom gray lines people's employment levels in the VITAS and Access cohorts compared to their willingness to take on additional work that's captured by those top two lines. And what this tells us is that there is an opportunity gap between what people are doing and what they're willing and desiring to do. And that opportunity gap is something that we should be focusing on. And we asked people how much additional work that they wanted, and there was a range of answers, but that spike that you see in this graph at 40 additional hours of paid work per week is the group of people that want full-time work. We also asked them about what activities they wanted to undertake. Again, there was a big range here. And we've rerun these analyses with more recent data from the Assessing Economic Transitions or ASSET study. And so this data goes all the way up to April of this year. And we see that that gap still exists between levels of work and wanting additional or better work. So recognizing this gap, there is an ecosystem of organizations on the downtown east side and around the neighborhood and in adjacent areas that are innovating to try and fill that gap, to provide accessible, meaningful opportunities for people. And this is a visualization of that provided by Exchange Inner City that demonstrates just a sample of the organizations that are working to provide opportunities across a range of different opportunity types, ranging from survival-based work all the way to full-time salaried employment. And the ASSET study, just to speak to that for a brief moment, is taking that livelihoods continuum that's been developed by the community that recognizes all of the different kinds of economic activities that can be undertaken and tries to evaluate the patterns of economic activity and the impacts that that economic activity has. And so we are trying to develop an evidence base that supports organizations in their programmatic decision-making, that supports policymakers in potential refinements to existing institutional architectures around all of that, and provides anonymized data back to opportunity providers for their own evaluative purposes. And we have now, I think, about 340 people in that cohort that we've been following for some time. And some of the initial findings of this work is really telling. First, in the level of innovation that is being brought to the table by a range of organizations that recognize adaptations that can really support people's ability to make work for them. And I'm not going to go through each of these in a lot of detail, just to try and preserve as much time as possible for discussion at the end, but really thinking through what kinds of flexibility can be built into work structures, what kind of supports are needed in order for people to initiate and maintain work, how are people paid, and how does that support them, and what's the overall ethos of support, acceptance, respect, encouragement that can help people who have been facing barriers to the labor market traditionally start to think about their economic lives in a different way. And alongside all of these adaptations, one of the things that we're also seeing from the data from people who are undertaking these opportunities is a desire for formalization. So people are seeking wage transparency. They want to make sure that they are receiving equal pay for equal work and not being penalized because they're categorized, for example, as a peer worker. They're looking for health and safety supports, and they are grappling with institutional constraints around income assistance, around economic engagement, around ancillary benefits that really affect their ability to take on as much work as they would like to. And one of the things that we're seeing is that that flexibility and that need for formalization are often not compatible. What we're seeing is that, you know, most people who are doing the sort of adapted or supportive work are not considered formal employees, and that's part of what allows for the flexibility. At the same time, the sort of protections around formal employment that would be invoked by the BC Labor Code are not compatible with the flexibility of the work. I hope I'm making myself clear here, but essentially there's a tension between the flexibility that's needed and the formal institutional structures that allow for worker and opportunity provider protections. And so
Lindsey,
this
can I
yes,
jump in?
yes,
can we go
please,
back? Thank you. Can we go back one slide? So just kind of riffing off a bit of what you were talking there about how, the need for flexibility alongside some of the stuff, the guidelines that are set up. Like when I see this livelihood continuum, I love how clean and organized it looks, but I also invite anyone who's using this to maybe use a slide that also has it constantly moving around, right? Like the continuum does often doesn't look quite this clean, quite this organized. And, you know, so when we're, like, I'll talk about it a bit when I talk a bit more about just the importance of language and inclusivity and how we do it. So when we're talking about how do we redefine exactly what you're saying, the flexibility meeting within the guidelines and what's needed, let's show the chaos of what is the livelihood continuum when we're talking about folks that we're talking about the projects are being done on. So yeah, I just wanted to kind of pause there. Imagine this is moving around constantly as Lindsey talks, and just, on to the next one. Thank you.
Yeah, thanks, Tara. I think that's really important as well. And so some of the questions that we're asking based on the tensions that are emerging in the data is, you know, should there be a new category of worker to accommodate flexibility and enshrine formal protection? Is that even a possibility? How can income assistance regulations better support economic engagement? Because the constraints around earnings for income assistance really affect people in very significant ways in terms of how much they can work and whether or not they are willing to forego the ancillary benefits that come with their income assistance supports that they lose if they surpass their earnings thresholds. And also thinking about how we can really understand economic engagement for both its economic benefits, but also its non-economic benefits, because we're talking about social well-being, we're talking about mental health, we're talking about physical health here. And so how can we think about outcomes in a broader way? Another piece that I think has to be mentioned is that people whose drugs also rely on important but inadequate income supports. And while they're critically central to people's lives, just recalling that dotted gray line at the top of the income generation profile that I showed earlier, knowing that these systems can also produce harm. And I think for many people in the room, I don't really need to explain what happens on check day or welfare Wednesday when the provincial government distributes income assistance payments to everyone in the province on the same day, once a month. And, you know, what we see are a lot of increased activity around the drug market. There's a lot of elevated harms that happen. A lot of organizations adapt their opening hours depending on when they are over and under subscribed during that time. And we even see commercial adaptations. That picture in the bottom right corner is a cannabis dispensary that changed their operating hours so that people could go buy cannabis at midnight on Tuesday, the moment their income assistance payments appeared in their bank accounts. And, you know, it's important not to understate the consequences of that administrative decision And that administrative decision to disperse payments once a month on the same day has a logic to it, most certainly. But what you're looking at here are daily average deaths. And that lighter shaded category, that lighted shader block in the front is daily average deaths during non-income assistance payment weeks. And that dark blue at the top is the daily average death rate during income assistance payment weeks. And so we see this significantly elevated rate of drug poisoning mortality. And drug poisoning is just one of many harms that have been documented by a growing body of literature. And I'm not going to go through each of these in turn, but they range from drug-related harms to demands on first responders and emergency services, to barriers to service access, interruptions in care, exposure to violence, etc. And a lot of this research has actually produced calls to reform the ways in which income assistance is dispersed. A lot of them have entertained the possibility of, what about a different payment schedule? And reforming social policy to reduce drug-related harm is important, but it's also complex. And what that research has really identified is two signals. There's an individual signal for increased drug use and drug-related harm that comes from payments themselves. And we all have this whenever we get paid, as well as a social signal that happens when everyone is paid all at once. And the thing that's being consumed has a social driver, and drug use definitely has social drivers. So you can think about this in terms of maybe celebrating with colleagues after work on payday by going for a drink. And that might be the individual signal. And then the social signal comes when you stay for 4 drinks instead of the one that you planned, because you're having a good time and there might be social pressures to stick around or increase consumption. And so we really asked ourselves, could we disrupt those signals for increased drug use by staggering payments so that everyone wasn't paid on the same day, or by splitting payments so that people received smaller, more frequent payments across the month? And that's exactly what we did. We compared people in the government system experimentally with 2 other payment systems, one where people were staggered to different payment dates across the month, but not during payment week, and an intervention where people had their payments staggered and also split in half. And we partnered with a wide range of organizations to do this work: government, non-governmental, health service delivery, drug user advocacy organizations, etc. And our initial results came out a couple of years ago and are pretty complex. And so I'm going to break it down a little bit for people. This graph shows just a summary table of our results, but the key takeaways are that people who had a different schedule were about 1/3 as likely to increase their drug use on check day, on Welfare Wednesday, when government payments went out to everyone else in the community. They were also about half as likely to increase their drug use on the days when they were paid. So in their alternative schedule, when they got paid, they're about half as likely as other folks to increase their drug use. Where things got a little bit complex is that when we started to look at other drug-related harm, things didn't happen the way that we anticipated. And what we saw was a much weaker statistical signal, but a statistical signal nonetheless, that overall exposure to violence increased for people rather than decreased if they were on the alternative schedule. And to start to paint a picture of why that was happening, we talked to people about their experiences. And this first quote is from someone for whom the intervention really worked well. They said, "I noticed in the second month that I was managing my money a little better. I was able to make my money last a lot longer and pay off my bills and stuff. Maybe because it's not such a big day. Like, it's not welfare day. I'm getting cash, but it's not everybody's welfare day. I don't know why that would make it different, but it does. It's nice to be able to use your money the way that you want to rather than the way that you need to." Conversely, this is a quote from someone for whom it didn't work. She said, "I was glad in one way because I had money and I felt proud of myself for waiting that long. But when people started targeting me because they were all spent out and I had the money, that part felt vulnerable because I felt like people were trying to think of the ways they could get my money and stuff. When I was getting a different pay schedule than everyone else, I noticed that it was harder for me." And so what this tells us is people's financial management practices are as different as they are. And so trying to have a one-size-fits-all system is really tricky. Just want to reiterate, or not really reiterate, I just want to also share that in addition to the scientific component of the study, we talked to people across the province about what they anticipated would change if the policy changed around income assistance disbursement. And what we really found was that there is no consensus there. And if people are curious about that, the community impact statement is available. And there's a publication as well that describes our engagement process that was undertaken by Joanna Mandel, the knowledge broker for the study. And what we took away from that check day study was really that, you know, policy change has unintended impacts and often unexpected results. And what we piloted was no different. And you know, despite all of the safety precautions that we took as a part of that study, we still saw some really concerning results. And in light of that, we need to weigh the relative benefits and harms of policy change and make sure that we're tending to those unanticipated consequences and developing strategies to mitigate them. We also learned that it might matter if you stand out just as part of being a part of a research study. And so thinking through what would happen if we broadened that intervention, would it amplify risk? Would it mitigate it if everything else in the community was different as well? I think we can reasonably start to think about what those consequences might be. And where we landed in the end is that there is a case for individualized social care. We know that people's financial management processes are very different. And we know that for some people, a different schedule could be a lifesaver, and it was very effective for a lot of people. But there were people for whom it wasn't effective. And so what would happen if we were to use the increasing digitization of the income assistance system in British Columbia to allow people to choose for themselves what schedule would work best for them? The last piece of the logic that I really want to conclude by is that social policy is drug policy. And I hope I've demonstrated that, you know, income assistance and employment services and employment supports have an impact, are modifiable, and should be added to our conceptualization of what we're thinking about when we think about drug policy. We often think about criminal justice policy or health policy here, but I think social policy has a really strong role to play. And I'm just going to pass it over to Tara right away. But in conclusion, you know, just really want to emphasize that often socioeconomic well-being is really central to people's lives, but not central to research and often service provision efforts. That in our efforts, we should really focus on what can be changed. So thinking about policy and program relevant dynamics and things that can be modified. Really want to give a plug for doing intervention and evaluative research as an important research advocacy strategy in terms of demonstrating and examining what's possible. And really also want to reiterate the importance of keeping research and policy development grounded in the community. In my experience, pairing research so that it is initiated by community and in response to community need and is characterized by reciprocal learning opportunities really just strengthens our understanding of what's going on, and it just makes it more relevant. And with that, I'm going to re-acknowledge the team that has supported this work and pass it over to Tara for her thoughts and response.
Awesome. Thank you, Lindsay. Yeah, it's hard to say like what are my thoughts because literally just so much information in so many thoughts. So I wrote down some stuff to just kind of keep my thoughts organized. And then we'll just take up a little bit of time here and then make sure that we leave time, I think 30 minutes for a Q&A. So yeah, before I kind of talk a bit about some of the stuff I reflected on is kind of just naming language itself is pretty tricky, as I kind of named a bit ago, is, you know, like, what are we calling this kind of employment? Are we calling it low barrier? Are we calling it low threshold economic engagement? You know, like what is the most people-centered? What is the most empowering? But also recognizing it's tricky because how to change those policies, how do we change those conversations if we start using a radically different language than what policymakers, funders and such are common for? So even just the word peers, you know, not everybody's happy with peers. Some people want peers. Sometimes it's people with a lived or living experience. So we're kind of in this interesting spot. I don't think it's new, but for myself, it's new. And like, what language should we be using that's like inclusive while also changing and shifting the dial of like how to make change? Like if we're going to keep people exactly kind of in the same places that the research is showcasing opportunity gaps, we probably need to change some of the language, or we can keep going on the same cycles. So yeah, just before I get into it, naming how important, language is. Yeah, and Lindsey, thanks for inviting me to chat. We've had a lot of informal conversations over the years at different advisory things, different, conferences and stuff. And so really, really thank you for this opportunity. Yeah, I think similar to what was discussed in the last dialogue is I also don't have any letters behind my name, right? But I have been doing the work in the downtown east side for 18 years or this year. So those kind of the letters I'd like to use. But I also can't go forward with any of my conversation without also acknowledging 18 years is kind of like a drop in the bucket for the work that's happened over the decades before me. Even just acknowledging Dean Wilson, the first person in the series. I wouldn't be able to do the work that I do now without his kind of radical leadership alongside Van Du. And then also just Cali themselves as the radical new leader in like some of the youth. And yeah, so before I move into it, I just wanted to really kind of name that, like, I wouldn't be doing the work, and I myself wouldn't be here without that. And when I look at Lindsey's presentation, the first slide, all those stakes, that slide that showed and reflected about 2017, it names like my newness to the work. I was pretty naive because I only worked in the downtown east side. I just assumed it was like that across the board in all areas of harm reduction and low barrier type work. And then I was one of the people that got to drive those stakes across Canada, stopping in communities, to get more names, connect with community. And it's when I learned pretty quickly, as soon as you stepped out of the downtown east side, it was radically different out there. You know what I mean? Like, we were in Regina and almost arrested for just setting up a fake consumption site just to show folks what it was. Other places chased out, most of when we got to Toronto, it was still like they were still in a tent in the winter, like outside. So it's where I learned how different it was in the downtown east side. And it's where I started to make sure I was learning a lot about what's happened over the years. So yeah, I think probably one of the reasons Lindsey maybe asked me to talk today is in a lot of the different areas I'm doing a lot of the different work, or part of the different levels of what is the spectrum of employment and supportive employment, right? So as chair of the board of the Overdose Prevention Society and their director of special projects, we employ over 70 volunteers that work regularly in our 7 different sites. So some of those sites are consumption sites, some of them are washrooms, some of them outreach, some of them are food security. And then on top of that, we have folks who are just looking for work, literally wake up, maybe in the alley, maybe on the sidewalk, come in and they need some money, they need a job. So we have like small as needed work there. So that's like a full spectrum there. And it's one of the things with ops, you see some folks that are employed. Our managers come from people who used to be accessing ops or working at ops. Now we're in management as employees, down to folks, like I said, that are doing like as needed in the moment work. Sometimes it's sweeping outside, sometimes it's just running an errand. And the important thing about that, and Lindsey talks about it a few times, but all those folks come with wraparound support. So what are some of the non-economic benefits of supportive employment? That's one of them, is the wraparound supports. Another role that I work in is a director of operations for MySafe. So it's a Health Canada funded program across Canada, giving safe supply as a research. We're into our 4th year. Part of that is there's employment, peer employment in every machine that exists across Canada. So again, going back to like, what does peer employment look like in the downtown east side compared to what does it look like in Victoria? What does it look like in Winnipeg? And just learning how to try to replicate what we're doing in Vancouver and bring it over to Winnipeg, which is like, it's pretty new to having some of the work. They've been doing it underground. They've been doing it at a grassroots, just not as a paid endeavor. And when I think about some of the slides that Lindsey was talking about, is the need for stabilization for folks who use substances. MySafe, one of our biggest successes we saw is out of the Overdose Prevention Society. We got our funding near the beginning of COVID. Around that was the same time that we started to see the introduction of benzos to the already toxic drug supply. What we were finding at ops is the majority of our staff would start a shift. They would use their substances. Within 30 minutes, they were asleep for anywhere from 4 to 8 hours. We were like kind of baffled. How are we even going to run this site? Like, we can't have people not using substances. We can't have people using substances. And around that time is when Health Canada gave us some funding. And so the first 20 or so people with MySafe got their safe supply, the law date through MySafe, and we were able to now run those sites. We didn't have to worry as much. Folks had something with that. So like, again, what is a non-economic benefit to some of the work that we're doing is stabilization, is safe supply, like all those things tie in, right? Like we're not asking people not to use, can they use in a more safe way so we can continue with the work that's happening. Another program that I get to be a part of helping run is the Overdose Prevention Peer Research Assistance, also known as OPRA. It's kind of where I got to learn a lot about what is amazing community-based research. So working along Jeffrey Morgan and Stephanie Clegg, I got to be a part of, we're into year 4 of building capacity amongst community, including myself, to be involved in research every step of the way, from conception to publication, right? So what is it to be research? How do we do research? And building that capacity so that now at the Overdose Prevention Society, we don't have any research that happens out of ops without somebody that's a part of OPRA, either OPRA approved or on the committee. And I think that that's really important because it's not just a tokenistic approach to research, and it's something that I'm witnessing with Lindsey and witnessing with others, is there's a lot more community included in it, not just a part of experts at the end or experts in the middle, but conception throughout it all. And I think that that's what we're seeing, why we see so much amazing research coming out of the downtown east side, is the more and more that we're bringing community into it. And it's something I'm not seeing in a lot of my other research stuff in other parts of Canada, not quite to the same as I'm seeing in Vancouver. Yeah, and another part that I do is with the Spencer Creo Foundation. So as the executive director, you know, not everybody knows, so the Spencer Creo Foundation, it's a local family foundation, has a very loose mandate to create and support transformative opportunities for individuals. Really broadly, what does that look like? It can look like a lot of things. And so to talk about today, though, it focuses on, we have a a support worker specialist program that provides wraparound supports to folks employed at social enterprises. So pretty much, what do they need outside of work to be able to show up to work? In talking with social enterprises, what was one of the biggest strains on running business? It was all the work that needs to happen outside of work hours or during work hours for folks that are struggling in lots of areas of substance use, housing, you know, basically poverty. And if you're trying to, you know, like Soul Food Farms, you're trying to farm, you're trying to get all the produce out, but you have these folks that they don't have housing. Like, what are you supposed to do? Do you stop farming to find housing? Do you feel housing's not as important as farming? You know, and so it became a bit of a gap that we were able to fill with the Spencer Creo Foundation. And more recently, working with Vancouver Coastal Health, able to provide the same wraparound supports to folks employed at consumption sites across different nonprofits. You know, and it's like, what do those all have in common? It kind of seems like everything that I'm talking about somewhat is in line with what Lindsey's finding and has found and continues to find with the work. And that's that the socioeconomic well-being amongst folks who use drugs equates to stability, individual well-being, and transformative change, right? And so that's kind of all I have to say about like trying to reaffirm what Lindsey was saying with like so many slides and so much information is how do we disrupt this? Like, we're already disrupting it, right? It already exists. Lindsey, I think you were talking about, how do we talk about the flexibility? How do we create what research is showing that people do want to work more, that they need the flexibility in it? Like, is it different hours? Is it breaking down tasks? You know, is it implementing more work within traditional workplaces, or is it creating more supports for nonprofits, for consumption sites, for social enterprises, right? And I think the answer we know is it's pretty much across the board. If it was one answer, we would have it. But that's what comes up over and over again. And a lot of the research that Lindsey shared with me is everybody wants something a little bit different. You know, it's talking about the check day. Some people do want staggered, some people don't, you know, and so we need to find these opportunities using research, using community experts to showcase, again, like the experts in the room, have people have choice, have opportunity. How do we create that? It's like stop the pigeonholing of like, you know, current work BC, current standards, current, you know, even income assistance. Like, why aren't we having bigger conversations with government and changing policy? Like, I think we're working towards that, obviously based off of some of the research. But it comes down to how do we bring people into these conversations and not have to keep doing research after decade of kind of the same thing. You know, it's been proven enough. So I try not to come to too many talks without a takeaway. I guess my takeaway is for those that are on the call that are part of those conversations or maybe part of research is let's continue with the innovative ways that we're doing it by changing the conversation, changing the dial. Let's use what we already know and let's like really let's kick it into high gear with that. I think that I was able to get it done in time for the 30 minutes that we were hoping for a Q&A. Unless, Lindsay, did you have anything you wanted to bounce back or?
Nothing except to just really reinforce how practice in the community and the research is really aligning in this area in I think really important ways that point to opportunity, right? That point to need and that point to opportunity and point to a relatively concrete way forward in like navigating some of those dynamics that you talk about where, you know, when people are faced with the choice of like showing up for work or trying to make sure that they have stable housing, like these are impossible choices. And really, if we are going to prioritize people's well-being, that we need to support them to navigate those choices much more, like to either basically eliminate the impossible choices and create choices that are much more empowering for people. Yeah. And I mean, I think I'd love to leave the last half hour for questions, but you know, in our conversations, Tara, over the years, it's really reinforced to me how like the research and the practices is pointing to the same things that need to change, and changing that conversation is critically important and a critical first step in making that happen.
Excellent. Thank you both very, very much for your talk today. I've found it incredibly informative, and I'm sure our audience has as well. I'll just remind the audience for the question and answer period, if you want to use the raise hand function that's available in the reactions tab at the bottom of your screen. That's one option, and then I can give you the power to unmute yourself. Another option is to send messages using the meeting chat. So either to myself or to Lindsay or to Tara, and we can read them out loud that way. I will note that there was one question in the chat already about sharing the slides, and I'll note that Lindsay has graciously agreed to share her slides today. They'll be posted online when we post the video for today's talk, and I'll be sending out a link to everyone who registered through Eventbrite for that. So I'll give people a moment to collect some questions and get the talk started. See, we've got a question from Linda. You should be able to unmute yourself now, Linda. There we are.
So the Purpose Society is trying to redevelop a property we have that is now office space into transitional supported housing. And of course, I'm in Westminster, and it has created, you know, a backlash, as you would suspect, which is often common. And what I'm struck with as I'm going, you know, to speak to groups of people, you know, the absolute lack of knowledge that people have about people who use substances and people who are homeless. And I mean, you know, as we do as humans, I think, or some of us do, it's easy to create stereotypes, and that's what they operate on. And when I go to talk to them, you know, I'm struck with the magnitude of my task, which is to educate people. And, you know, like, we're all listening, and, you know, it's all supportive and great to hear all of this great work, but how do we get this information out into a broader community and educate people about what has to happen? Because of course, you know, they're not looking at things like, well, you know, employment and social policy. That's not how they're thinking at the moment. And like I said, you know, right now, having gone to, you know, city council last Monday and listening to people just spew hate because we have, you know, serious homelessness population here in Westminster. And it's just very, very sad. So does that make sense, my question?
Tara, do you want to jump in first, or would you like me to go?
Go for it. Yeah.
I mean, Linda, thank you for the question. And I mean, I think I'll be brief with a multifaceted answer. And I think in the first instance, there is an imperative for people who are doing research to be as good as possible about disseminating it and to thinking about how we disseminate it. And I also, you know, what you're talking about is essentially trying to move public opinion around something that has been criminalized and stigmatized for over 100 years. And so it is, it's not an easy answer and not an easy solution, but I think thinking about strategically, what are the venues that have the broadest readership? What are the places where there's the possibility of providing information that might serve to challenge some of those stereotypes is a question that we should all be asking ourselves. And also just knowing that, you know, over the last however many years of doing this work, that science only gets us part of the way, right? It's one piece of a broader puzzle. And so we all kind of need to move forward in our own way at the same time to try and really dismantle some of the inaccurate and stigmatizing stereotypes and stigma that gets perpetuated, which is an unsatisfying answer, I recognize.
No, and I don't, you know, I don't even know if my question was appropriate. It's just my, you know, like I'm dealing with a situation. I'm wondering whether, you know, that the groups who do gather the kind of information that you presented us today, I wonder whether like you could create like almost like a newsletter or something that we could subscribe to. And then I could have that, you know, at my fingertips and use it like on a daily basis when I come across folks who are oppositional to what we're trying to promote. I mean, I don't know. I'm just sort of searching and reaching because I'm, like I say, I'm just feeling very sad about the whole situation.
You think I could kind of add to a little bit there what Lindsey was saying. Like Lindsey said, there's the science part of it. Obviously, you know, there's research to it. I think the idea, I'm sure there's some sort of a newsletter or something that can be linked to so that you have that. Recognizing again, every neighborhood's different and, you know, each thing is different. Even our political climate is now different and moving and changing. I do find that there are champions within the folks that are even naysayers, right? There are people on the fence that, you want to kind of, you're not going to change everyone's minds. Like you can't, even on the other side of that, the folks that spew the hate and really do hate substance users, they're not going to change mind ever. So I think about the other way of flipping that, right? Like, and who are the people in the middle, and who are those champions that you find? So it's not necessarily you that's trying to change people's minds. It's the people within their peers. Like, who are the champions within their peer group that can help have those conversations? You know, on the other side of that too, when I was opening a whole bunch of cold weather shelters in I guess in Cole Harbor, they hated us. The level of violence that was coming at us, you know, and stuff was pretty horrific. But once we started like individualizing it, started working with some of the folks in the strata that were actually curious, and that it did change a bit of the conversation because they were changing the conversation, right? Like it wasn't me. I was a manager of a shelter they didn't want there, but the person who lived in the same building with them was willing to have that. So one of the things I can offer as a suggestion is, who within the neighborhoods that are currently not wanting you there, who wants you there, and how can they be a part of helping to change that? Because it's not always the societies that are bringing the people into the neighborhood. It's the people that already live there that help change the conversation.
Yeah, I get what you're saying. I think you're right. When I went to talk to that group of people, and I talked a little bit about the effects of homelessness and things like that, you know, I could feel that energy shift in the room. And I do know that maybe they're not, it didn't get so far as that they would support the project, but I certainly felt a little bit of a shift in attitude and energy, right? So maybe that's all I can hope for in a day, and you just keep going out there and doing the same thing like you do. Yeah, thank you.
Thanks for that, Linda, and for the response, Lindsay and Tara. Do we have any other questions from the audience today?
If not, I have a question for Tara.
Absolutely, go for it.
I mean, my question, Tara, is, what is the research that you would like to see, right? Is there something that you think could be a pivotal sort of turning point around the conversation that's been having? What do you think is needed?
I think that's a great question. And I think it's hard to answer because, like, again, I think that there's other experts that can be in the room to answer a more robust of a question. But it kind of also comes down to, like, if you were to ask me this question pre-COVID, I would have had a different question. In the middle of COVID, another question. And it's one of the things I do see with research is a question's made, it happens, and 8 years, 5 years, 6 years later, it comes out. So also recognize that does shift. I do think more of this kind of research makes sense, right? Like, what is the economic drive that does change policy, that does have, even, like what Linda was saying, even naysayers, like taxpayers who are angry at people who use substances, how do we change their mind is by showcasing people are giving back to society. People are worthy of a policy that doesn't kill. Like the necropolitics that we're currently existing in is it's pretty devastating. So, like, how do we change social policy is we kind of got to speak within the language that we are, which is exactly that, is economically, how do we prove that folks who currently are seen as not contributing to society actually are in lots of different ways. So that's like a bigger one. So keeping with that, and another one that I would love to see, and I don't even know how we'd go about it, but like even just around community mutual aid, right? Like, I think specifically in the downtown east side, I think about some of the convenience stores that don't receive social money for anything are the ones that are like carrying tabs, letting people store their stuff there, selling without getting anyone in trouble, selling single items, everything from bowls of cereal to, cigarettes, things like that. So, like, how do we capture the mutual aid that's happening in community and show, because like it's something we hear about a lot in the downtown east side. We hear a lot of different even a lot of the work I do down in Ohio, some of the work I'm doing in San Francisco, and within substance user groups is community is always taking care of community. And I think it's one of the reasons why we're seeing a lot of burnout is it's much longer do we have to take care of community in this accelerated crisis thing that is no longer a crisis. It's 7+ years in, it's like 30 years in, like it's not really that crisis. So one of the things I would love is like more asset-based research, not assets, the research, but asset-based, it's like mutual aid. What are some of the ways that community has been, continues to hold each other up? And then even from that is potentially building, like often out of research, toolkits come out of that. How do we give toolkits to other communities who are maybe feeling the burden? Again, downtown east side is quite many years ahead. When I think about some of the work I'm doing with some of the other communities around North America, is they're feeling burnt out and they're just a few years into it, and so like how do we share what we learned from it? So I guess that's kind of some of the research I wouldn't mind seeing.
Great, thanks.
I do have, excuse me, another question from our participants today. So Evelyn has asked, can you please speak more to how you can determine the direction between substance use and market attachment or stability? Is it all from qualitative work, or have you been able to see quantitatively in the work as well?
A good question. So a lot of the conceptual work comes from qualitative narratives, from talking to people about first this happened, then this happened, and this is how they're connected. But we have been able to do some quantitative work, and happy to connect with you also about what that looks like. But what we end up doing is because For example, the VITAS study, the access study, the asset study, and ARISE are all longitudinal in that we talk to people, you know, in the case of VITAS, access, and ARISE every 6 months, in the case of assets every 3 months. We're able to sort of say, okay, first this happens, then this happens. That said, you know, scientifically speaking, the best way to determine causation is experimental work, which is what we did with the check day study. And so the check day study has a bit more of a robust causal inference. You're able to tell from the data what caused what because of the design of the study. But quantitatively, we have been able to do that as well. And, you know, we always have to be cautious about the claims that we make and what we infer and the language that we use around that inference. But one of the things that we've gotten really clear about in all of that work is the relationship between economic well-being and drug use is bidirectional, right? It goes both ways, and that people's drug use can affect their economic engagement, and people's economic engagement can shape their drug use. And so when you have a phenomenon like that, where it goes both ways, analyzing it, it becomes really tricky. And so you just have to be cautious and do the best that you can with the data that you've got.
Yeah, absolutely. Thank you for that. I don't have any other questions coming in, but I do have some thank yous from some of our attendees today. Thanking both yourself, Lindsey, and Tara, for your time. Maybe do we want to give one more minute to see if anybody else has anything they'd like to say? And if not, we can sign off. All right, so I don't see anything else coming out, but I do want to thank both of our presenters today very much for your time and for sharing all of your expertise with us. I'd also like to make sure we thank our audience today for joining us for the final episode of season 1 rather. And season 2 will be starting up in September, so keep a lookout for details on that in the coming months. Thank you everyone for your time today, and enjoy the rest of your day.